This is for nasotracheal suctioning, so we're going to make sure we have check the patient's chart and have the order in the chart. Then we're going to make sure that we have the supplies ready in the room. We have our suctioning connected to the wall. We have our oxygen source and our device to use. And then we're going to have our sterile suctioning kit that we're going to take to the patient's room. We would walk to the patient's room, knock on the door, and introduce ourselves. Hello, Mr. Blank. My name is Tricia with Respiratory Care. Today we're going to do some suctioning through your nose. You have your nasal airway in place, and we're just going to help you remove some of those extra secretions through there, make you feel a little bit better. So can I get your name and date of birth? Okay, you've verified the patient. Then you're going to do your assessment. You're going to get your vital signs, place a pulse oximeter on his finger. Mr. Blank, I'm going to keep that pulse oximeter on your finger throughout the entire process and just watch your oxygen level. If for some reason that oxygen level would begin to drop, we want to stop what we're doing. And then we could maybe put our hand on the chest, asking permission first. We may be able to feel those secretions, so that's a good indicator before and after that we can tell if we've completed the removal of those secretions. So we've done our assessment. Mr. Blank, the next thing I'm going to do is put some oxygen on you because we want to make sure you're good and oxygenated through this process. So we would have this connected to the wall, oxygen. We would put at least 5 liters or more for right now. Then we will get our supplies ready. We have our sterile suctioning kit. We would open that and we would put our gloves on here. In our sterile suctioning kit, we have our catheter, we have some lubrication, and then we have a little cup that we can put the sterile saline into. So we want to try and keep one clean hand and one sterile hand. So through this, I will try and keep this as my sterile hand. And then prior to opening all of this, we want to turn on our suction. Our suction would be set to -100 to -120 as this is an adult. So then we would remove our catheter from the kit here. We'd make sure that saline is very handy. We can use that prior to the suctioning. We want to make sure that the catheter and the suction is working. So what we would do, we're going to open that lubrication first. We're going to make sure we have that lubrication either on that sterile kit somewhere to remain sterile or put it in the palm of our hand. But we would put the tip of the catheter into the saline and then we would occlude that thumb port. So when we occlude the thumb port, we would watch the saline come up through the catheter. That just ensures that the suction is working. So then we ensure the suction's working. We have lubricated the tip of the catheter. Then, Mr. Blank, I'm going to remove that oxygen and we are going to start here. Just need you to breathe nice and easy for me. Be as relaxed as you can. Through this process, if you don't cough, I'll instruct you to cough at one point. So that's all you need to do. So we would advance that catheter. Do not occlude the thumb port. Through that near there, we're going to advance the catheter. First resistance we feel, that's when we instruct Mr. Blank, go ahead and give me a cough. That goes through the vocal cords. Then we're going to push a little further. Second resistance is the carina. At that point, we would pull back slightly and then occlude the thumb port. Then we're going to start to twist that catheter as we pull it back out. So we're twisting, occluding that thumb port, pulling that back out, and we've completed that suction. So with this process, we want the entire process to last less than 15 seconds. The time that our thumb is on that port there, less than 10 seconds. So we've completed that suctioning. We would discard the catheter, place the oxygen back on Mr. Blank, and then we would complete another assessment. Throughout this time, we've been monitoring, kind of peeking down, looking at the oxygen level. We're going to assess him again, look at his breathing, vital signs, feel again to the chest to make sure those secretions have been removed. Then we're going to oxygenate for him for 1 minute. We will remove that oxygen, and then we will ensure we've answered any of his questions. We made sure he's comfortable, and then we would document what we've done.